Good to meet you, Senator Casey. Thank you for taking the time for this conversation.
Ady, good to be with you. Thank you. Good to have this opportunity.
What are you focused on accomplishing in this Congress?
So I've tried to focus on a range of issues that put a spotlight on the challenges families were facing during the pandemic and in the aftermath of the pandemic, and workers as well. That naturally led to a focus on an issue like home and community-based services for seniors and people with disabilities in the workforce. Those workers who do that essential heroic work that is only paid $12 an hour, an indication that they're badly underpaid.
President Biden has asked Congress for a $400 billion investment in home and community-based care. You've been an outspoken proponent of this bill. Can you please explain why this legislation is important and what it would do?
First of all, to provide so many more Americans with the opportunity to have those home and community-based services. But right now, for most Americans who are considering long-term care, the nursing home is the only option. So many families would choose to have care in the home. And for people with disabilities, as you know well, having that option to have care at home or in the community where you're closest to the people you love, you're closest to the real world, and you're able to participate in your community in a way that's consistent with your hopes and your dreams about how to have care provided, how to have services provided to you and to help your families. The problem is we've got at least 800,000 Americans on a waiting list for home and community-based services. And, just to be blunt about it, there are more of them in red states than blue states. So far, we haven't been able to convince the Republican Party in the Senate that this is essential, that we can't call ourselves the greatest country in the world unless we have the best home and community-based services in the world. We're America. We should provide the best services.
Can you tell me about the workers who provide home care in Pennsylvania? Who are they, and what are their jobs and working conditions like? What would this bill do to improve those conditions?
The working conditions can be challenging, but when you have the pay scale of $12 an hour paid to this workforce, which, by the way, is a workforce mostly of women, and of those women, mostly are women of color. Our system of providing the best home and community-based services in the world would all be better off if those individuals could join a union. Because if they have a union, they're likely to be paid a better wage, they're likely to have benefits, and the kind of economic security that they should have a right to expect. If we say they're heroic, we pat them on the back, as we did so many heroic essential workers in the pandemic, we ought to pay them the wage that their work deserves.
What do we need to do to get this bill enacted into law? What are obstacles and what do we need to do to overcome them?
Democrats are going to have to come together to fund home and community-based services. That's the only way we can get this done. So as much as I would hope that we could pick up some Republican support, I think that's going to be difficult. Now, it's possible, and I'm just being strategic here, it's possible that getting a few Republicans to support us in funding home and community-based services at a robust level. We need a big, bold investment here. As I said, $400 billion.
Even though Democrats control the House, the Senate, and the White House, much of our agenda is being blocked by the filibuster. And even on this issue of HCBS, we probably need unanimous Democratic support. But, your neighbor from West Virginia, Senator Joe Manchin, says he will not support voting rights legislation without Republican support. But no such support is materializing. Where do we go from here? Will the Democrats' whole agenda be sacrificed at the altar of bipartisanship?
It used to be in the old days that sometimes that 60 vote rule would force consensus to get some more votes on the other side. But try as we might, that's not happening. So you have this bizarre circumstance where on one side, the Democratic side, you're trying to make progress on so many substantive issues that we've had very little progress on. And on the other side, they don't have much interest in legislation.
We are singing from the same hymnal. I agree with your point, and I don't think that it is only your job in Congress. We in the movement need to raise the temperature too. It took massive nonviolent direct action to win the Voting Rights Act, and I think we need the same thing today. I want to talk about Medicare. Recently, 17 senators signed a letter to President Biden urging him, as part of the American Families Plan, to reduce the eligibility age for Medicare, expand benefits to cover the full body to include dental, vision, and hearing, and negotiate with pharmaceutical companies to lower the cost of drugs. Even lowering the age from 65 to 60 would allow coverage for 23 million people, including nearly 2 million that are currently uninsured. Will you continue your legacy and commit today to join the 17 other senators in supporting Medicare expansion so that we can significantly improve the millions of lives you have fought for so long to protect?
Yeah, I think we've got to use this opportunity the moment we're in on a whole range of issues, including changes that would provide more opportunities under Medicare and Medicaid. I've got a proposal which we have not yet put in bill form, but we've got an outline of a proposal to take the Medicaid program, to take it and expand it to the other end of the age scale, which is to expand it to include every child who doesn't have health care. We still have 4 million children in the country that don't have health care, and there's no reason why we should not just enroll every child in Medicaid when they're born, and then if their parents want to have them opt out and be in some other kind of health care, that could be their choice.
I like that idea a lot. Please sign me up as a citizen co-sponsor and let me know how I can help. Thank you again for your time and your advocacy. I appreciate all that you have done to lead the Senate in the fight for disability justice. And I am grateful for your moral clarity on the need to change the rules of the Senate to meet the moment we are in.
Thank you.